You might think you know what old age means, but for some of the world's most unique hoofed animals, like the majestic camel or the swift deer, that definition gets a fascinating and sometimes pretty startling twist.
Yeah.
Today, we're taking a deep dive into geriatric diseases in two distinct families. Camelidae, so think camels, llamas, alpacas, and cervidae, which covers deer, elk, and moose.
And our sources, they reveal not just what goes wrong as these animals age, but why it matters, and how human management profoundly shapes their twilight years.
Right.
Our mission here is really to unpack some surprising facts and crucial insights into conditions you'd rarely, if ever, see in the wild.
And what's particularly interesting, I think, is that the very idea of a geriatric animal for these species is largely a product of human intervention, isn't it?
Yeah.
Extending lives beyond their natural ecological peak.
Exactly.
So, okay, let's unpack this. What does geriatric even mean for these animals? Is it just hitting a certain age?
It's absolutely not just a number, no. The definition of geriatric, it's a really flexible concept. It's deeply influenced by a species' natural longevity, the husbandry practices they're under, and even like the environmental pressures they face. It's not simply their chronological age.
Okay.
It's more about reaching a point of natural decline, senescence.
That makes perfect sense. So how do those factors actually play out when we look at, say, the lifespans of camelids?
Well, with New World camelids like llamas and alpacas, they typically live for maybe 15 to 25 years in captive or domestic settings.
Right.
So for them, we usually consider the geriatric period to begin around 10 to 12 years of age. It just gives caretakers a kind of marker for when to start looking out for age-related conditions.
Okay.
Now, contrast that with Old World camelids like dromedary and Bactrian camels. They have much longer lifespans, often 35 to 50 years.
Wow.
Yeah. So for them, geriatric usually begins after 15 to 20 years, and it's often marked by significant dental wear, which really impacts their nutrition.
That's quite a difference. And what about cervids, like deer, elk, or moose? I imagine their wild and captive lifespans tell a very different story.
They absolutely do, a completely different story. In the wild, a white-tailed deer averages a mere 2 to 3 years.
2 to 3, that's it.
That's it, on average, even though their maximum potential lifespan can exceed 20 years.
Huh?
Wild elk usually live 10 to 15 years, and moose average maybe 7 to 12. These numbers are just heavily influenced by predation, hunting, environmental stress.
All the usual suspects in the wild.
Exactly. But in captivity, a white-tailed deer can live up to 23 years. Elk can live beyond 20.
So if they can live that long, why is their average wild lifespan so short? This really emphasizes that the geriatric animal, especially for cervids, is largely a product of its management environment, right?
Absolutely.
Why is geriatric almost an ecological rarity for wild cervids?
Well, because very few wild cervids actually survive long enough to experience true senescence, that natural age-related decline. The term geriatric in that context is it's almost meaningless because they simply don't reach that age naturally, most of them.
Right.
So the whole concept of geriatric care applies most meaningfully to animals in captive or domestic settings,
Right.
where human intervention has successfully extended their lives way beyond what nature would normally allow.
That's a fundamental shift in their life history, isn't it? So when we talk about aging, we're talking about a progressive decline in physiological function.
Yeah.
What are the key biological markers you look for in these animals as they age?
Well, we look for things like advanced dental wear, the onset of degenerative joint disease like arthritis, and just a general decline in immune competence. These all make them more vulnerable to disease. But what's crucial here is how the captive environment fundamentally alters the entire life history of these animals. By removing or, mitigating the primary drivers of mortality in the wild, things like predation, starvation, or acute environmental stress, we allow them to live to an advanced age. We basically create a geriatric population that simply wouldn't exist otherwise.
So when we extend these lives, what's the sort of unexpected consequence of that success? Are we inadvertently, creating a whole new set of health problems by trying to help them live longer?
In a way, yes. It's kind of a trade-off. This extended lifespan allows for the full expression of age-related degenerative diseases. Conditions like neoplasia, that's cancer organ failure, and osteoarthritis. These are rarely documented in wild populations simply because few individuals live long enough to actually develop them.
And is it just the absence of wild threats, or does captivity introduce its own set of challenges and risk factors?
Oh, it absolutely introduces new risks. Think about diets composed of processed feeds, which can lead to abnormal dental wear, or reduced opportunities for movement, which contributes to obesity and makes joint disease worse.
Right, less space, less activity.
Exactly. And even things like high-density housing can facilitate pathogen transmission, which isn't typically such an issue in wild dispersed populations.
So what does this fundamentally change about how we approach their veterinary care? It sounds like the field of geriatric medicine for these species is almost exclusively a concern of captive animal management.
That's pretty much it.
We've shifted from managing acute threats like injuries or starvation to providing long-term, often palliative care for chronic conditions.
That's precisely it. Our success in extending their lives brings these new responsibilities in managing the conditions of old age. It's a completely different mindset for the vet, really.
Okay, let's turn our attention then to some of the common degenerative conditions that arise with age, starting with musculoskeletal issues. Osteoarthritis seems like a universal problem, right? Common in both families, leading to pain, lameness, stiffness.
Yeah, definitely. It's very common. But there are specifics for camelids beyond just general achy joints.
Oh,
Well, in camelids, beyond the classic age-related osteoarthritis, there's a really distinctive and significant issue called dropped pasterns.
soft bastard.
Yeah, it involves a bilateral breakdown. So on both sides of the suspensory apparatus of the fetlock joints, basically the support structure fails, leading to hyperextension, where the pastern drops towards the ground.
Ouch.
Yeah, its prevalence and severity increase with age, and interestingly, especially in geldings. Some think it might be linked to lower testosterone levels, but that's still being looked into.
And how do you manage that?
Management for this is purely palliative. There's no cure, really. It's just about providing comfort and support.
Right. Palliative. That sounds like a tough condition to manage. And what about cervids? Are they dealing with the same kind of age-related wear and tear in their joints? Or is their arthritis often linked to something else entirely?
It's quite different for cervids, actually. While, yes, age-related osteoarthritis certainly occurs, arthritis in cervids is often secondary to underlying conditions.
Secondary, meaning caused by something else.
Exactly. For example, in elk, it can be linked to bacterial infections like Brucella abortus, which causes brucellosis, or necrotic stomatitis, that's a bacterial infection of the mouth, which can lead to septic arthritis when the bacteria get into the bloodstream and settle in the joints.
Wow.
And traumatic injuries are also a common cause of what we call post-traumatic osteoarthritis.
That's a huge difference. So if you see a limping older animal, how does that immediately change your thinking, depending on whether it's an alpaca or an elk?
Oh, it completely changes your entire diagnostic approach. A limping geriatric alpaca usually points you toward primary degenerative osteoarthritis wear and tear.
Okay.
But a limping geriatric elk, that immediately raises alarms for an infectious disease like brucellosis. And that has significant implications for both herd health and public health.
Right, because brucellosis is zoonotic.
Precisely. So you'd be thinking about containment, testing, broader health issues, not just the individual animal's pain. It's a whole different level of concern.
So, okay, managing this pain and immobility, how do we approach it? What's the sort of holistic approach to keeping these animals comfortable?
It's definitely a multimodal approach. You have to hit it from different angles. Environmentally, we focus on providing soft, deep bedding, making sure they have flat, accessible living spaces, and easily accessible food and water.
Makes sense.
For camelids with dropped pasterns, sometimes confining them to smaller level pastures can really help reduce strain on those joints.
Okay. And pharmacologically, drugs.
Yeah, pharmacologically, NSAIDs, non-steroidal anti-inflammatory drugs, are primary tools for pain and inflammation, much like in humans or, dogs and cats.
Like ibuprofen for animals?
Sort of, yeah. Things like flunixin, meloxicam, phenylbutazone. Some are better for acute pain, others for chronic, depending on how they're given or how long they last in the body. But, and this is a crucial caveat, long-term NSAI use comes with significant side effects.
Like what?
Things like gastrointestinal ulceration and renal damage, kidney damage, especially if the animal is dehydrated or already has some kidney issues. So careful monitoring is absolutely essential.
Okay.
We also use other analgesics like opioids in certain situations, maybe drugs like xylazine or lidocaine drips to manage more severe pain. It's about layering the approach.
And I've heard about complementary therapies being used for animals too, things like acupuncture. Do those apply here?
Yeah, there's anecdotal evidence suggesting that things like joint supplements, glucosamine, chondroitin acupuncture, physical therapy, even botanicals like boswellia or more recently CBD oil can be helpful for chronic pain.
Interesting.
While, more rigorous scientific validation is often needed for these specific species, they're frequently part of a holistic palliative care plan, especially for high-value animals in zoos or private collections. People want to try everything to keep them comfortable.
If an animal can't eat comfortably, nothing else really matters, does it?
Yeah.
So naturally, dental health must be absolutely critical for aging hoofstock.
Oh, fundamental. Absolutely fundamental.
What kind of dental issues do camelids face that are unique to their aging process?
Well, you're right. Dental health is key. Camelids have continuously growing teeth, which normally wear down as they chew, but in older animals, this balance just gets disrupted.
How so?
You see severe incisor attrition, wear on the front teeth, making it hard for them to grasp and tear forage. Then, uneven molar wear creates these sharp enamel points on the back teeth.
Ouch.
Yeah, they cause painful lacerations to the cheeks and tongue, and that can lead to quitting, where they drop partially chewed balls of cud from their mouth because it hurts too much to chew properly.
That sounds awful.
It is. Tooth loss is also common, and when one molar is lost, the opposing tooth, because it keeps growing, can overgrow and cause further problems. And perhaps most significantly, camelids, especially alpacas it seems, have a high prevalence of tooth root abscesses.
Abscesses. Under the tooth?
Exactly. They're incredibly painful, cause these bony swellings on the jaw, and can lead to systemic illness if the infection spreads. They often require complex surgical extractions.
Wow, that sounds incredibly painful and complicated. And what about deer? Do they deal with similar age-related dental issues, or is their dental story different?
It's pretty different. In wild cervids, natural attrition, the wear on the teeth, is a primary age-related change. It's even used by biologists to estimate their age. Severe dental disease in the wild is likely a major limiting factor for survival. If you can't eat, you don't last long.
Makes sense.
But in captive cervids, the most prominent dental pathology we see is something called lumpy jaw, or necrobacillosis. Now, this is important. It's not a primary degenerative disease of the teeth themselves, like the wear and tear in camelids.
Okay, so what is it then?
It's an opportunistic bacterial infection of the jawbone. It's often initiated by trauma, like getting poked by coarse or abrasive feedstuffs, which are common in supplemental feeding programs in captivity. It forms these hard, pus-filled abscesses in the bone itself, quite different from the intrinsic dental degradation you see in geriatric camelids.
That's a crucial distinction. So given these diverse dental challenges, wear, points, loss, abscesses, infections, what's the key to keeping these older animals well-fed and maintaining their weight? Nutritional management must be critical.
Absolutely. It's paramount. The main strategy is providing feed that requires minimal mastication, minimal chewing.
Like what?
This means things like soaked hay pellets or cubes, chopped hay, or commercially formulated senior pelleted feeds. For camelids, you also need to ensure any supplemental feed is low in carbohydrates but provides adequate fiber that's important for their digestion.
Yeah.
And crucially, you need to ensure older animals can actually consume their food without competition from younger, more vigorous herd mates. Sometimes that means separate feeding, which can be logistically challenging but makes a world of difference for the older animals getting the nutrition they need.
Yeah, you don't want the seniors getting pushed out of the way. Okay, so beyond teeth and joints, what are the sort of silent threats that emerge as these animals age? Those internal systems that start to falter, maybe without obvious external signs at first.
Yeah, there are definitely some sneaky ones. One significant one is hepatic lipidosis, or fatty liver disease. It's particularly common and often fatal in camelids.
Fatty liver. How does that happen?
It's fundamentally linked to a state of negative energy balance. Basically, when a camelid stops eating for any reason, could be stress, pain from arthritis, dental issues, any other illness, its body rapidly mobilizes fat stores for energy.
Okay, like an emergency backup.
Exactly, but their metabolism is so efficient at this that the liver can just get overwhelmed by this sudden influx of lipids. It can't process it all, leading to impaired function and potentially liver failure.
And you said the signs are vague.
Very vague, often. Things like lethargy, weight loss, just not doing well. It makes early diagnosis challenging. So prevention, by carefully managing stress and promptly addressing any reason they might go off feed, is really critical, especially in older, more vulnerable animals.
That makes sense. And kidney issues, I know those are common in aging mammals across the board.
Yeah.
But I understand alpacas in particular have a very specific and preventable risk when it comes to renal failure.
They do, yes. While chronic renal disease, just like general wear and tear on the kidneys, is common as they age, alpacas have this specific vulnerability: vitamin D intoxication from oversupplementation.
Too much vitamin D.
Yeah. Alpacas evolved in high-altitude South America and are incredibly efficient at synthesizing vitamin D from sunlight. So if people oversupplement them, thinking more is better, especially in climates with less sun, it can lead to hypercalcemia, too much calcium in the blood soft tissue mineralization, and fatal kidney failure.
Wow. So it's preventable, but you have to know about their specific physiology.
Exactly. It's a stark reminder that more isn't always better with supplements. And just reinforcing a point we made earlier about NSAIDs, long-term use is a significant risk factor for renal damage, particularly in animals that might be dehydrated or already have some kidney compromise. Careful monitoring of renal function is vital if they're on those drugs long-term.
Right. And for cervids. Any specific kidney issues?
In cervids, kidney diseases seem to be more frequently found in captive populations, probably because they live longer there and there are better diagnostic opportunities. We sometimes see congenital malformations like underdeveloped kidneys that might only cause problems later in life.
It sounds like all these systems are so interconnected. What happens when one organ system fails, maybe leading to problems in another? Can you give an example?
Oh, they certainly are interconnected. For instance, congenital cardiac defects in camelids' heart problems they were born with might not cause issues when they're young, but can lead to congestive heart failure in older animals as the heart's ability to compensate just diminishes over time.
Okay.
And respiratory failure is often secondary to other conditions. In camelids, something called megaesophagus, which is a dilated, poorly functioning esophagus, can lead to aspiration pneumonia if food or liquid is accidentally inhaled into the lungs.
Because they can't swallow properly.
Right. And similarly, in cervids, late-stage chronic wasting disease can impair their ability to swallow, which also often causes aspiration pneumonia. That's frequently the ultimate cause of death for those affected animals.
That brings us, actually, to our next big discussion point, the redefining role of major infectious diseases. Because beyond those chronic age-related issues we've discussed, some diseases just profoundly redefine what old age even means for these animals. Let's dig into chronic wasting disease, or CWD, in cervids for a moment. What exactly is it?
Right. CWD is a fatal, transmissible, spongiform encephalopathy, often called a prion disease. It affects members of the deer family: deer, elk, moose.
Prion disease, like mad cow.
Yes, in the same family of diseases. It's caused by a misfolded protein, the prion, that triggers other proteins to misfold. It's always fatal, and there's currently no treatment or vaccine. A key and really troubling feature is its long incubation period.
How long?
Anywhere from 18 months, maybe 2 years, up to several years. And during that time, the animal appears perfectly healthy, but is shedding infectious prions into the environment through saliva, urine, feces.
That's scary. And why is it often called a pseudo-geriatric killer? What are the clinical signs that make it mimic aging?
Well, the clinical signs typically manifest in mature animals, not usually the very young. And they include drastic weight loss, hence the wasting name, along with behavioral changes, things like listlessness, losing their natural fear of humans.
Oh, wow.
Yeah, it's quite striking. You also see excessive salivation, sometimes stumbling or ataxia, which is a lack of muscle coordination. Because these signs of progressive decline appear in older animals, it can easily be mistaken for just a natural wasting syndrome of old age. But it's absolutely not. It's an infectious process.
So what's the broader ecological consequence of a disease that looks like old age but isn't? Does it actually prevent animals from reaching old age in the wild?
It absolutely does. The prevalence of CWD, how common it is strongly correlated with age. Older animals, especially males for some reason, are more likely to be infected.
Why males?
It's thought to be related to behavioral things, maybe more movement, different social interactions, stress during the rut. But older animals in general have just had more time to be exposed. So in areas where CWD is established, it becomes a primary driver of mortality for adult and older cervids. It effectively truncates the age structure of the herd.
Truncates, like cuts it short.
Exactly. It prevents many individuals from ever reaching their maximum potential lifespan. It's a disease that, by its very nature, prevents true old age for a significant portion of the population it affects.
And how is it managed, especially in farm deer?
For farm cervids, management is very strict. The USDA has a CWD herd certification program, which involves intense surveillance. It mandates testing of all cervids 12 months or older that die on a farm for any reason. And any animal showing suspicious clinical signs must be reported and euthanized for diagnostic testing, regardless of age. This really underscores older animals as being high-risk targets for disease surveillance.
That's a powerful and insidious disease. Now, if CWD slowly, insidiously prevents old age, foot and mouth disease, or FMD, seems like almost the opposite, an anti-geriatric force that just wipes out older populations instantly if it hits. Tell us about FMD.
Right, FMD is a completely different beast. It's a severe, highly contagious viral disease affecting all cloven-hoofed animals. It's one of the most economically devastating livestock diseases globally, partly because it spreads so incredibly fast. And there are 7 distinct serotypes, meaning immunity to one doesn't protect against the others.
And how do our two families, Camelids and cervids, stack up in terms of susceptibility to FMD? Is there a big difference there?
Oh, a huge difference, a stark difference. Pretty much all species of deer, Cervidae, are generally susceptible to FMD. Mule deer and white-tailed deer are considered highly susceptible, and they can transmit the virus easily to other deer and even to cattle.
Right, I remember hearing about outbreaks.
Yeah, the historical 1924 California outbreak is a classic example. It led to the culling of over 22,000 wild deer to try and stop the spread to livestock. Elk seem to be a bit less susceptible than deer.
Okay, and camelids.
Big contrast. Bactrian camels, the 2 humped ones, are susceptible, but dromedary camels, the 1 humped ones, are highly resistant and aren't considered epidemiologically significant, meaning that they don't really play a role in spreading it.
Interesting resistance. And llamas and alpacas?
New World camelids, llamas, alpacas exhibit very low susceptibility. If they do get infected, they usually show only mild signs, and they're not considered efficient transmitters or long-term carriers of the virus.
That low susceptibility in New World camelids is good news for them. But what about the carrier state? I know that's a major concern for FMD control. Does that apply to both cervids and camelids?
The carrier state is a huge challenge in FMD. This is where ruminants can harbor the virus for extended periods, we're talking months, maybe even years, in their throat tissues, the oropharynx, without showing any clinical signs.
Wow, years.
Potentially, yes. This has been documented in cervids like fallow deer and white-tailed deer. And it remains a major concern for international trade regulations because these apparently healthy animals can unknowingly shed the virus and start new outbreaks.
Okay, and camelids. Do they become carriers?
Crucially, no. Camelids are not known to develop this carrier state. That's a major difference for disease control strategies.
So if we connect this to the bigger picture then, an FMD outbreak has a really dramatic impact on populations, doesn't it? If the stamping out protocol is implemented, what's the demographic consequence for the geriatric population specifically?
It's drastic, absolutely. The primary control strategy during an FMD outbreak is stamping out. That involves a mass depopulation culling of all infected and susceptible contact animals within a defined geographical zone.
All of them, regardless of age.
All of them. The culling process is completely non-selective with respect to age. It removes every susceptible animal within that zone, whether it's young, prime age, or geriatric.
So no geriatric survivors in that zone.
None. An FMD outbreak, therefore, results in the immediate and complete removal of any geriatric individuals, captive or wild, from the affected area. This action effectively just resets the age structure of the local animal populations. It prevents the very existence of a geriatric population segment for potentially a decade or more until a population can rebuild and age again.
Wow. That stands in such stark contrast to the slow, selective pressure of CWD.
Completely different impacts, yes.
So CWD prevents animals from reaching old age, while FMD ensures that, for a time, there are basically no old animals at all. That brings us to thinking about comprehensive geriatric care and end-of-life considerations for the animals that do reach old age under our management. Nutritional management sounds like the absolute foundation.
It is, absolutely. It underpins everything else. As animals age, their metabolic rates might decrease slightly, and maybe more importantly, their ability to digest and absorb nutrients can decline. And that's often compounded by the dental disease we just talked about.
Right.
For camelids, maintaining an ideal body condition is a constant challenge. They seem prone to both obesity, which is terrible for their joints and overall health, and becoming underweight, especially if they have poor dentition.
So specific dietary adjustments are definitely needed then. What kind of adjustments are we looking at for an older camelid or maybe an older zoo deer?
Yes, adjustments are key. This often means supplementing with higher energy concentrates or grains carefully. Providing highly digestible and easy-to-chew feeds is critical. Things like soaked hay pellets or cubes, chopped hay, make it easier for them.
Less work for aging teeth.
Exactly. For alpacas, there are commercially formulated senior feeds with smaller pellet sizes that are often ideal. It's crucial to ensure they're getting adequate protein, adequate fiber, and the essential vitamins and minerals, especially things like vitamin D, but not too much, calcium, and phosphorus in the right balance.
And the competition factor again.
And as we mentioned, ensuring those older animals can actually consume their food without being bullied or pushed aside by younger, more vigorous herd mates. Separate feeding areas or times might be necessary. It's vital.
Okay. As animals age, the focus for veterinary medicine often shifts, right? From curative treatment to more palliative care aimed at maximizing comfort and quality of life. What are the key components of palliative and hospice care for these large animals?
You're right, the focus definitely shifts. It involves, first and foremost, judicious pain management. Using those NSAIDs and other analgesics we discussed for chronic conditions like arthritis, always with careful monitoring for side effects.
Okay, pain control first.
Then environmental comfort is crucial. Things like providing deep, soft bedding to cushion joints, ensuring they have flat living spaces without steep slopes, making sure food and water sources are easily accessible without too much effort. Even providing additional protection from bad weather, maybe coats for camelids in the cold or barn-safe heaters in winter stalls.
Little things that make a big difference.
Huge difference. And don't forget social and psychological well-being. These are often herd animals. For social species like llamas and alpacas, you should never just isolate an old one by itself. If they need to be moved to a special needs pasture, always ensure they go with a familiar, bonded companion to reduce stress.
That's a great point.
These principles, they were really established for companion animals like dogs and cats, but they're directly applicable and just as important for high-value geriatric animals in zoos, sanctuaries, or private collections.
And sometimes the most compassionate act is also the hardest decision: euthanasia. What's fascinating to me, and what our sources highlight, is how the decision-making process and the ethical framework surrounding euthanasia seem to vary radically depending on the animal's context.
They truly do. It's a completely different calculation sometimes. Think about it. For a companion animal, like someone's beloved pet llama, the decision is intensely personal for the owner. It's guided by quality of life assessments. Is the animal still happy? Is it suffering? And it's focused entirely on alleviating that individual's suffering. It's an act of deep compassion, usually from a caregiver who loves that animal.
Okay, that makes sense. But then for an animal in a managed collection, like a deer in a zoo, the decision involves a whole professional team: vets, curators, zookeepers. How does that change the ethical considerations?
Exactly. While the individual animal's welfare is still paramount, that decision is also informed by institutional policies. By resource allocation, can we continue to provide the intensive care needed? And sometimes, maybe, by the animal's genetic value to species survival plans if it's part of a conservation breeding program.
So broader factors come into play.
Yes, it's a more formalized process, guided by animal management protocols and welfare science. It often involves balancing the individual's needs with broader population or institutional goals.
And then, the most stark contrast. A wild deer with CWD may be identified by surveillance. How is that decision fundamentally different? It's not about an owner or even a curated collection.
It shifts dramatically again. While ending any obvious suffering might be a component, the primary driver there is public health and animal population health.
Disease control.
Precisely. The act of euthanasia becomes a disease control measure. It's aimed at removing a source of infectious prions to protect the rest of the herd and prevent further environmental contamination and spread. The decision is not primarily based on the individual's quality of life at that moment, but on its status as an epidemiological threat.
So it's less about the individual, more about the population.
Fundamentally, yes. It's an act of population management driven by disease control needs with very different ethical underpinnings than the decision made for a pet.
This divergence really highlights the incredibly multifaceted roles these animals play in human society: pet, exhibit, wild resource, disease vector, and the very different ethical responsibilities that arise from those roles.
It really does.
We've just navigated this really complex world of aging camelids and cervids, haven't we? Revealing how their golden years are shaped not just by biology, but so profoundly by the human hand. From dedicated care extending life far beyond the norm,
to global disease threats like FMD that can just wipe out entire age groups overnight.
Yeah. The very concept of a geriatric animal for these species seems largely a construct of our success and sometimes our interventions in managing their environments.
That's a great way to put it. And as human practices continue to extend the lifespans of these incredible creatures, you have to wonder what new ethical and veterinary challenges might emerge down the road. How far are we willing or able to go to manage the complexities of extreme old age in these animals?
And what does quality of life truly mean when you try to apply it across such diverse animal contexts? From, a beloved pet alpaca in someone's backyard to a wild elk potentially carrying CWD or a dromedary camel facing FMD threats.
Exactly. It forces us to think. We really encourage you, the listener, to reflect on these contrasts. Consider the remarkable ways different species and our interactions with them challenge our understanding of what it means to grow old.